Hello, I am Dr. Kushal Hippalgaonkar, orthopedic surgeon at Sunshine Hospitals. Today I will be talking about osteoarthritis and some of its causes and symptoms. So, if this is the knee joint, that means the thigh bone called the femur and the leg bone called the tibia, then this is your knee joint. Now, the knee joint has a covering layer called the articular cartilage, which is typically worn out in osteoarthritis. So, osteoarthritis is a degenerative condition which affects this covering layer, that is the articular cartilage of joints. Now, coming to the causes of osteoarthritis, osteoarthritis is mainly a genetic condition. That means if you have a family history of osteoarthritis, then you are more likely to have the same. And other things that may lead to osteoarthritis are any trauma in the past, that means any injury that you had to your joint, which will later, because of the abnormal loads that the joint experiences, later get worn out and then lead to arthritis. That can also cause osteoarthritis, or it can also be some repeated stresses on the joint. So, conditions that cause repeated stress on the joint, they can also cause osteoarthritis, and there is also obesity. So, people who are obese are susceptible to osteoarthritis. So, these are some of the causes of osteoarthritis. Now, coming to the symptoms of osteoarthritis, as we said, it can affect any of the joints in the body, but the most commonly affected joint is the knee joint. The symptoms are pain. That's the first symptom that a patient experiences. Typically, the pain comes when the patient sits or stands from a chair or walks or climbs the stairs. These are the times when the loads on the joint are extreme, and therefore the pain is more severe. Other than pain, there can also be a swelling of that joint. Sometimes what is called a crepitus, that means a sound emanating from the joint, that can also be noticed by the patient. And in more advanced conditions, the symptom can be a restriction of the range of motion. That means if the joint moves a full 130 degrees at the knee joint, the movement will be restricted. That is also the late stage symptom. Other than that, sometimes a patient experiences a deformity in the knee. So, that happens also at a later stage, and some bony prominences can also be felt by the patient around the knee joint. So, these are the symptoms. Therefore, when you experience any of these symptoms, especially pain on and off or swelling in the joints, then it's better to go to the doctor immediately and start your consultation with the orthopedic surgeon, because catching this condition early will prevent any surgical intervention at a later stage.